May is National Stroke Awareness Month. A stroke can severely affect the brain, and it's important to receive care if you have any stroke symptoms. Neuroradiologist Monique Meyer shares with us exactly what happens to the brain when a stroke occurs. I'm here with Dr. Monique Meyer, and today we are talking about strokes and stroke awareness. Doctor, thank you so much for joining me. If we can start by talking about exactly what a stroke is.
So a stroke occurs when either the blood vessel to the brain is blocked by a clot, or if the blood vessel ruptures into the brain. Now, if the blood vessel ruptures into the brain, it's called a hemorrhagic stroke. And when the blood flow is blocked, it's called an ischemic stroke. An ischemic stroke happens when there's a clot to the blood vessel, and so it makes it so there's no blood flow to the brain in that area, and that brain can die. So basically we say that time is brain. There are two treatments that can be considered for a patient that's having an ischemic stroke. Now, all patients that come to the emergency room should get a non-contrast head CT, and they should also get their glucose tested, and that's a minimum requirement. Now, as a radiologist, what I'm looking for on the head CT is looking for any signs of obvious already blood in the brain, masses. If the person has a relatively normal brain head CT, they would go on to get a CTA to see if they're a candidate for the other treatment option, which is mechanical thrombectomy. So the way I take care of patients is by reading their imaging studies.
So what is your ultimate advice to people out there as they are learning about stroke throughout Stroke Awareness Month?
Don't ignore the signs or symptoms of stroke, because if you don't come to the hospital, there may be no treatment options for you, and you may be left with severe neurologic deficits from it. A lot of people ignore the fact that they're feeling dizzy or have a severe headache, or they think they're tired, and that's why their speech is slurred. But even if you wake up from sleep, you should still go to the emergency room and see if there's something that can be done to help treat your stroke symptoms.
Absolutely. Thank you very much, doctor, for your time.